All right, so Jason, thank you for joining us. And would you mind telling us a little about you and your professional work?
Sure. Thanks a lot for having me, Matthew. So I'm a physical therapist in Rochester, New York, at the University of Rochester Medical Center. So Rochester is kind of upstate New York. We're maybe 5 hours from New York City for the international listeners, just kind of getting a gauge on how big the state of New York is. Um, so my main interest has always been in running, even before becoming a physical therapist. I was an avid runner growing up. Fortunately, knowing what I know now about sports specialization, I didn't actually get into specializing in running until I was about 16 or 17, after I played a lot of ball sports and contact sports growing up.
And what do
Um,
you mean by knowing what we know now? What are you referring to there?
Yeah, so there's there's a lot of some of the research on youth sports specialization at this stage. Adam Tedforty's group has done a lot of good work in that area, basically looking at the incidence of bone stress injuries in athletes, um, and the ones who never played any type of contact sports before their growth plates closed, essentially. So men around age 16 to 18, women a little bit before that, 15 to 17 or 18 range. The group that never did any high contact or plyometric type loading seems to have lower bone density or higher risk for bone stress injuries down the road. So
Hmm?
that seems to be one of those, you know, it's modifiable. It's a modifiable factor, but you usually don't know that it's modifiable until it's at the point where it's not modifiable. So it's
It's
kind of
too late.
unfortunate for some of the people in their 30s and 40s reading that literature. Like,
Whoops. So, I mean, does soccer count?
oh yeah, yeah. So
All
so
right,
it
I'm good.
would be, yeah. You're good. You're good. Anything that involves change of direction, sprinting, so high speed running, jumping, landing, or physical contact. So usually a couple of years of, say, soccer, basketball, lacrosse, football, all those types of things. Then that then seems to be more protective against bone stress injuries down the road. And it probably just has to do with, well, by the time your growth plate's closed, if you've built up a certain amount of bone density, we know that's the window where it seems to be the most malleable. And then after
Hmm.
that, you're set with what you built.
Okay. Well, let me just translate a little for the young cross country athlete listening. I guess what you're saying is that in order to make your bones tough enough for all the running you're intending to do, you need to do sports that aren't just running. I mean, how come running isn't enough? What is it that it's lacking that stimulates that bone to get really dense and more resilient?
Yeah, that's a good question. It seems like running is not necessarily osteogenic, but it's kind of at like neutral. So running doesn't really seem to be harmful for bone health, but it doesn't seem to help either. It's kind of just at that amount of loading where it's not really going to be enough impact to stimulate bone density improvements. Um, but it's not so low like a anti-gravity situation or swimming or cycling that
Hmm.
it would actually be deleterious longer
Hmm.
term.
Okay, so it'll sort of maintain your bone density as you develop, but if you haven't got sufficient bone density in the first place, which is the case when your bones are getting longer and bigger,
Right.
then you need some other kind of stimulus. And it seems to be, is it any sort of multi-directional sport will suffice?
Yeah, it seems to be that, and there's probably a certain number of years that you would need to do that for it to
Hmm.
kind of be effective. Like, it may not just be like, well, let's play 3 months of basketball and then we'll be good for the rest of you. But
Right, yeah.
yeah, so I think there's still a lot unknown about that, because some of that stuff is retrospective work too. So
Hmm.
we don't really, we know that there's a lot of factors that go into it, but that seems to be a strong one too. And for some kids, that can be a easy sell. Just saying like, all right, this summer you're just gonna go out and have fun. Join a soccer league. Don't worry about running for the summer. Um, and then others who just are kind of have it set in their mind that they want to be a runner and they don't really want to do anything else. That's where it's probably a tougher sell. At least just do this until you get to age 16 or 17. And then if you want to specialize, go for it. But
well, I mean, I don't work with lots of like a large volume of youngsters. I have some, right? But so I haven't really delved into the research on specialization so much.
Mm-hmm.
My sort of quite superficial understanding is that from terms of development, bone health, avoiding injuries, growing a healthy human body, that we need to have this kind of mix and match of all sorts of different sports and be very active, generally speaking, in our developmental years.
Yeah.
What's it? Where does it stand on performance, though? Is there is specialization going to afford you a performance edge that you could sacrifice your bones to? Do you know?
Right. Yeah. I think that's such a tough call, because especially in the sport of running, where it's generally like the more you do, the better you are. How do you tell somebody, well, I want you to do less than 9 months out of the year of this sport? I want you to do something else other than this sport that seems to be volume dependent. And now I'm telling you to do that. And it's more maybe for health than it is for performance. But you then make the case that if somebody is going to burn out, and even if it was optimal for performance in the adolescent setting or in the high school setting to specialize and run 12 months out of the year and maximize volume, it just seems like that's kind of a weird area to go. To have a kid burn out by the time that they're 17 is really tough.
Some parents, man, they're just like, whatever it takes. So I guess another way of looking at it, again, unfortunately, this is an area of research I haven't looked into at all, would be like the net volume. If running performance is to a certain degree largely influenced by the amount of running that you do, if you take a 10-year period from age 12 to 22, if you are constantly battling shin splints and bone stress injuries because you only ever run, the amount of volume you'll actually do in that 10-year period may be less than someone who only does it 9 months out of the year and can do 9 months every year because they play basketball the other 3 or whatever it is.
Sure. Yeah, that just speaks to what's a sustainable training plan. Because this is a sport that where consistency is king. You would much rather be the runner who runs 3 to 4 times a week for 5 years straight than the runner who has some of these heroic track sessions, and they put in a 3-month great block of training, and then they race, and then they get injured, and then they're battling that for a while on and off for 5 years. Now it's the runner who has put together the most consistency over time at the end of the day, or at the end of the year, or at the end of their career, is going to be the runner that's most successful.
Right. And is that the same for avoiding injuries? If you're consistently training with tweaks or little fluctuations in the type of volume of training, is that less likely to result in running injuries than someone who is training with more variety through the year? Maybe having an extremely high intensity block, then an extremely high volume block, then playing another sport for a while. Do we know?
Yeah, that's a great question, because that's what we intuitively would think. We would think that training spikes are riskier from an injury standpoint, and that if somebody just maintained pretty solid consistency for a while, then that would reduce the risk of an injury. There's a couple problems there. The first one off the bat that I can think of is that to actually see that training spikes increase injury risk, you have to have a pretty solid definition of what training load even is. And that's a thing that's been brought up quite a bit lately with like some of Max Paquette and Chris Napier and Rich Willie's stuff on how are we even quantifying training load? Because if we can't come to a common definition or quantification of it, then we're never really going to get to the point where we see studies that show that if you increase by this much over a 2-week period or whatever, that's going to put you at higher risk of injury. Because you can run 5 kilometers on one day at a given perceived exertion, and you can do it on another day at a given perceived exertion. And are those training loads the same? Are they a little bit different? we know that there's a lot of things that go into the pot when it comes to what is training load or stress on your body anyway. So I think from a research standpoint, it's going to be really, really hard to tease that out. But I think what we could say is that just on face value, it seems like if you do all these different things and you do them quickly, then it doesn't give the body a good enough chance to adapt. And that then comes kind of into conflict with what we recommend for youth athletes, which is, well, I want you to do a lot of different stuff. Go from lacrosse season into football season into indoor track or something like that.
And how is someone to make sense of that? How could that be a positive habit to induce the kinds of adaptations that will create a human that will be more resilient to injury versus, being too, I don't know what the word is, but keeping things too similar over time.
Yeah. I to me, and this is pretty much just my speculation, I think that there's this window in adolescence where the top goal is probably just build a well-rounded athlete.
Right.
Build the base, build the foundation. And to do that, you do have to have variety. And so in those times of variety, you're probably not worrying too much about, well, I'm changing too many things at once here, going from one sports season to another or something like that. And youth athletes are going to be more resilient to change than some of our us masters athletes as well. So there's probably more room for error, I guess, if you want to call it a training error. There's more room for it. So
and maybe even what might be an error in changing, let's say, intensity from one week to the next for you or I would actually be a helpful adaptive stimulus to a 14-year-old. Because they went from they had I don't know, maybe they were sick and did nothing for a week, and then they were excited and they played soccer for 3 hours every night for a week, and you or I would be unquestionably injured by that. And they, like you said, they have just a lot more, I think of it as adaptive capacity. They just have a lot more room for maneuver than the mature, skeletally mature athletes, or skeletally more mature. So that was, this is what I wanted to talk to you about, was running injuries. And, we touched on, you mentioned bone stress injuries a few times. And could you clarify what that is for the runner? And is this something that runners get a lot?
Yeah. So bone stress injury is a general category of a group of specific injuries. So, something common like shin splints or medial tibial stress syndrome is the low end of a bone stress injury to the tibia. So if that goes down this spectrum progression, it could turn into a tibial stress fracture. So at its essence, a bone stress injury is just that the rate of bone breakdown exceeds the rate of bone buildup. So you're just in this negative balance. And that's just because the stress applied is exceeding the amount of time or ability to adapt and recover.
And is that why they come on gradually? Because it might only be it's like, you spend a little bit more each month than you earn. In the first couple of months, it doesn't cause you any issues. But after 12 months of that, you're like, oh, whoa, look at this credit card debt is getting pretty. Is that why it comes on slower for the shin splints type bone stress injury type of things usually?
Yeah, it's fascinating because there's some cases where they just come on right like that. I mean, we think about like the preseason ramp up of training is where we see quite a bit of the medial tibial stress syndrome in a lot of our ball sports and also in cross country and track. And that's just from a 2 week window of ramping things up. Sometimes, there's definitely there's some debate on what constitutes a bone stress injury too, because you can see a bone stress injury on MRI of an asymptomatic individual. So then this is kind of a question of, well, is it a bone stress injury if you're just seeing bone marrow edema or some sort of stress to the bone, but the runner is totally asymptomatic? And if that's the case, you're going to see a lot of bone stress injuries in a lot of collegiate runners because most of them have that type of of thing on imaging.
Mm-hmm.
So there's probably some amount of just this in heavier training blocks. You're going to see a little bit more of that when the total amount of work is exceeding the ability to recover between sessions. And that's kind of how we think about all running injuries.
Yeah.
Essentially.
Is that where the term, I've heard it used in different contexts, the term bone stress reaction, is that where this comes in?
Yeah, I think I kind of consider a stress reaction is just the low end of the spectrum from a bone stress fracture. And
Mm-hmm.
that spectrum are just called bone stress injuries.
Mm-hmm.
So you
And what you're
see that
referring
like,
to, sorry, what you're
yeah,
referring to there is, you can see these reactions, these inflammations of the bone in often collegiate athletes, particularly in the time of year when they're, in the springtime when they're sort of ramping up their volume,
yeah.
and they often don't hurt. They don't actually have shin pain, but they've got this reaction. So it's not quite as simple as we would like it to be.
That's then when you get into the discussion of, well, does pain have to be present for it to be an injury? And
we shall not be opening that can of worms.
yeah, I'm good.
I've tackled that in other episodes. I will refer my listeners back to previous episodes with Greg, Mike, and Merv, and you can listen to that. So I guess if we start at the beginning, what type of injuries are most common among runners?
Yeah, so this is going to be highly population dependent, but if we just look at all of the data that we have, some combination in any given study, you're going to see patellofemoral pain, Achilles tendinopathy, medial tibial stress syndrome, and then numbers 4 through 6, 7, 8 might be iliotibial band syndrome, plantar heel pain, things like that in some different order. But you pretty consistently see the top 3 or 4 are going to be centered around the knee and the lower leg.
Could you just sort of flesh out those top 3, 4 in a little bit more like kind of a 101 type of terminology, just for anyone who isn't familiar with those terms?
Sure. So patellofemoral pain, this is just going to be kind of your broad-based kneecap-related pain in the absence of a lot of other things like knee instability or traumatic injury or things like that. Probably one of our most common running related injuries because the quadriceps are responsible for doing so much to overcome braking force during running. That's been kind of the subject and target for a lot of gait retraining studies is how to reduce braking forces to take a little bit of load off the anterior knee. So that's probably one of the most common ones that I treat clinically. The patellofemoral pain, interestingly, not necessarily associated with any one structure, at least that we know of right now. Generally, an MRI will kind of come back with a shrug, maybe a little bit of bone marrow edema underneath the patella, or some kind of structures around there, but it does not really seem to be related to tissue damage. And that's kind of a theme with quite a few of our running related injuries as well. Achilles tendinopathy going into kind of one of our other most common injuries. Tendinopathy itself is kind of a whole area of research looking at just how tendon dysfunction relates to tendon pain. Again, those are not always going to be present along with each other, but we'll leave that part out.
Yeah, fair enough.
And the Achilles tendon is responsible for the majority of our propulsive force during running. So it's not surprising that that's going to be an area where we see a lot of injuries. The calf muscle itself is taking on pretty significant body weight loads. So, just a structure that's stressed quite a bit during even just easy running. And kind of probably say third most common that I would see clinically and that shows up in a lot of the studies would be medial tibial stress syndrome, which was originally thought of as like a bone traction injury where the muscles in the lower leg were pulling away from the bone and creating that stress. And it's now kind of transitioned into thinking this is actually just more of a bone loading problem. Marinus Winters has done a lot of good work in this area. He's a really phenomenal researcher in medial tibial stress syndrome. And it's kind of pointing out all the areas that we don't really know about it. We're not really that great at rehabbing it, and it takes a long time to rehab, and it's a really tricky injury. But those are probably kind of like the top three that most clinicians are probably seeing quite a bit.
Is shin splints a fair wording to use for that injury, or is that one of those that's sort of misrepresented and could cause confusion?
Yeah, I think I will still use it along with its medical term when I'm describing it to a patient, just to kind of like, most people have heard of shin splints. So it's kind of like how you might tell somebody, hey, this is like, have you ever heard of tendinitis? Well, tendinopathy is, and then you go into the kind of longer explanation. So probably just one of those things where I'll say it just to kind of get people into it. I don't know if I'm not particularly in love with medial tibial stress syndrome, or really any pathology that has a syndrome after it, but also not at the point where I would start to name things myself.
What we call it, shin bone pain is going to be my proposition. But you often get, when you start getting really into the nitty gritty, I don't know what you've found, but when you really start to dig down about what we know for certain, you often end up calling things shin pain, knee pain, foot pain. This is as precise as we can be sometimes, and then you don't look very clever.
Yeah, exactly that, because then you're just like the person walked in with pain in their kneecap, and you're telling them that they have pain in their kneecap.
Yeah, it's like you have anterior knee pain or patellofemoral pain, and then you explain what it is. It's like, oh, it's pain in your knee. So
yeah, it doesn't seem inherently helpful.
So you just hope that they don't ask for a definition of what that term actually means. So if we take those top three, is that, do we know? I mean, I know that they're three distinct areas. Are there commonalities that runners could look to that might help us understand what is likely to make us get a running injury, which would include any of those top three or others, or do they all have a distinct sort of pathway depending on different variables that don't have a common theme?
Yeah, it's the second one. Okay. That's why this is so hard.
Yeah, fair enough.
It's I think we've kind of come to the end of we've come to the end of the road on analyzing all running related injuries together. Because you see a lot of these studies that where the outcome is running related injury. Yep. And so that outcome is a bunch of heterogeneous things all together. And then we're trying to say, well, here are some of these variables that are associated with that thing that actually represents this massive construct of a bunch of stuff that might even not be related together.
Right. Okay.
And at this stage, that's why we've seen a lot of these some of these systematic reviews that just say, hey, the only thing that's really common amongst all these things is that if you had it in the past, you might have it again in the future.
Right, yeah.
There's like, there doesn't seem to be a specific biomechanical variable that's consistent among
running. It would be the only one.
You have to run, to get a running related injury. Okay. But yeah, it's tough then, because probably what's good for some is not good for others, or what's bad for some isn't bad for others. And if you analyze all those things as a whole, at the end, you're just left with nothing. And you're kind of sitting there. And so it's really tough from a research standpoint, because what you're asking then is, okay, don't do the whole general thing. Analyze each running injury specifically. And the problem with that is you would need sample sizes in the tens of thousands to be able to appropriately power, so that when you did finally get a certain number of runners with patellofemoral pain, runners with Achilles tendinopathy, and medial tibial stress syndrome, there would be enough runners in each of those subgroups that you could analyze a couple different variables. And that's what the Run Safe group out of Denmark is doing right now with their Garmin study. They're attempting to get 20,000 runners into a study, so that then when they do get these pools of subgroups of injuries, they're going to be able to kind of look at some training metrics associated with those. But they're also then limited with, they aren't able to analyze anything from a biomechanical standpoint, because it's all remote Garmin data. So it's hard stuff.
Yes. And I've heard of that study. It's quite exciting, but like you say, you can immediately see, and I'm sure the researchers doing it see themselves that they're going to be missing big pieces of the puzzle as well, just by the nature of the study.
Yeah.
But like you said, in order to get that sample size, and I mean, this is just to clarify for me as well as the listener. I think what you're saying is the reason you would need is such a large amount of runners to put in a study to determine what is a real risk factor for, let's say, patellofemoral pain, is because you need a certain amount of runners to actually get patellofemoral pain in that group. So if you had 100 runners and only one of them got patellofemoral pain, that just might be random chance, and you can't really analyze
Yeah.
any variable that might help you explain why they got it. There's no commonality between one runner if there's only one of them, or if there's two. That's not enough to say, oh, look, they're both women, so women get it both.
So that's exactly it. There's a great example of this is in another one of the run safe prospective studies. There were 930 something runners in this novice running study, and just based on our epidemiological data, we probably see anywhere between like 25% and 40% of runners in a given study will get injured. So you have to then expect that between 25 and 40% of those 1,000 runners you're going to have as just general injuries. And then when we look at just the epidemiological data on which running injuries are most common, patellofemoral pain is the most common, but it's probably sitting around 10%. So then you have that 10% of 25% means you got to have a ton of runners in your study if you want a big enough sample size to then cut it up a few different ways. And even at that point, there's a pretty high risk of running into that false positive or finding something significant that actually wasn't significant if you just don't have a big enough sample size.
And that's potentially maybe why in the past they've used this term RRI, or running related injury, and sort of grouped them, because you're like, well, if I get 100 runners, probably 40 of them will get injured. So you're going to get a decent sample. But having run those studies in the last few years, I think what you're saying is that it's showing that we can't determine any specific factors that are a general running injury risk. Or
other than a previous history of injury.
Right.
There just doesn't seem to be a recurring theme.
Well, I mean, that fits with what I've read, and it makes it difficult to make recommendations about injury prevention, right? Because you're like, well, I could give you my best guess. It's probably something related to training load. It's probably something related to rate of change in training load. But even that, like when I've looked at the research on that, we don't have much there either. No, I think I found 3 studies looking at that. And it was like one of them found that if you increased your volume of running, your kilometers per week, by more than 30% in a week, you're a bit more likely. And that's not a lot to go off, is it? It's
no. So Adam Holm's systematic review on this a few years ago is a really nice read, because it groups a lot of these studies by like, all right, these ones looked at increases in training volume, these ones looked at intensity, and you just you read through them, and it's like, we can't take anything away from this. There's like one study that says if you run more than this, you'll get injured, and another study says if you run less than that, you'll get injured, and that is inherently not helpful.
Okay. Well, these are the problems with trying to determine what are relevant things to pay attention to if you want to avoid running injuries. I read an article you wrote a while back about this difficulty of trying to research running injuries, and you mentioned in this article, which I'll link in the description for those who want to read, which is a very interesting read. You talk a lot about this TRIP framework. So what is that? What's going on there, and why is it worth paying attention to?
Yeah, so Caroline Finch in 2006 proposed this TRIP framework. TRIP is translating research into injury prevention practice, and I think she is one of the most accomplished injury prevention researchers in the world, and so she proposes this framework. I immediately latched onto that and said that this is the most logical thing that I've ever read
Okay.
in this area, because it builds on what we kind of already knew about the idea of injury prevention in the first place, which is these kind of big themes of, well, first you have to describe the scope of the problem, then you have to figure out what the mechanism of injury or the etiology of it is, and only then can you start to develop that measure and then implement that measure. Because if you start down here with just developing preventive measures without recognizing what the mechanism of injury is or even the scope of the problem, you're just throwing stuff at the wall to see what sticks.
Which is, I think, what we've been doing. Is that
For sure.
fair to say? Like I've seen a lot of injury prevention studies that, were based on the proposition that, let's say, high impact forces when you land are bad. So it's like they cause injury, so you know what I mean? And it's like, if we can reduce them, but then like you say, it's like, have we established that they are bad and that how much and that kind of stuff? Okay. So what are the first couple of stages of that you described over here?
Right, you're right. So in the running literature, you could say that first stage is just describe the scope of the problem, describe running related injury epidemiology. And I think we've done a fair job at that so far. We've kind of said, all right, in any of these given studies, we see between 25 and 40% get injured. We're starting to do a better job at subgrouping different populations. So we know that youth runners get different types of injuries than masters runners do. Elite runners are getting different types of injuries than some recreational or novice runners. There's still there's ways to go on that too. And, certain areas like defining what actually makes a recreational runner. Do they just turn into a recreational runner once they've been running for longer than a year? So there's going to be some issues in that area, but we have a pretty good idea what the most common running injuries are at this point. I think that's an important part of that step.
Yeah.
The second step, the establish the mechanism of injury or injury etiology. I think we have a theoretical framework that makes sense, and kind of built more off of that theoretical framework. We know that there are other things outside of it that also can influence it. So Michael Bertelson's running injury framework model is probably one of the more common ones that's gone around. That one was from 2017. And it basically is this model that at its core is just looking at tissue capacity versus tissue load. So
is that the one? Did you take a graph from that in your article?
I think, I think so. One of the adapted version of it. And it's essentially just that on running is a series of loading cycles for the limb. And we could say tissue X is getting loaded a certain amount per stride. And so within the scope of each single run, we're going to have a certain amount of cumulative load at tissue X. And then also across sessions, we're going to have a certain load capacity to start. And if we don't have enough recovery to return back to that original load capacity, then we could kind of see how that capacity decreases over time, or that the total amount of load, that cumulative loading, reaches the point of capacity by a certain session.
So it's, just like you said about the bone stress injuries, it's the tissue in question, be it the patellofemoral joint, the shin, or the Achilles tendon in the top three that we described. It's the difference between building them back up and breaking them down by training, building them back up by resting. If that is out of balance and then that goes on for a given time, then an injury will develop. Is that what we think is causing?
Yeah, I think that is theoretically what is described. And it doesn't take long to realize that that's almost impossible to quantify, especially from a tissue specific standpoint. Like we're not walking around with strain gauges in our patellas and anything like that. And then the other common criticism of that model is we know that it's not just about the biomechanical loading of tissue. We're carbon-based life forms. We have feelings. There's a lot of stuff going on. And that's what kind of like some of the other complex systems modeling looks at. Well, what about the relationships between, say, the next level up, which is how does coaching and medicine affect some of these downstream things like the development of running injuries? How does public education affect this kind of stuff? You don't have to look any further than what happened during the COVID-19 pandemic, looking at the different responses of lockdown from different countries and how that might have affected training patterns of certain runners. That's certainly, it's hard to say that didn't affect the development of some running injuries just based on changing training behaviors.
Yeah, I know there's a group in the UK doing a what do you call it? A study where they give you questionnaires because I'm actually a participant. They send me a weekly questionnaire and ask me about my training volume and if I've had a vaccine, if I've had COVID, if I've had an injury, if I, all this kind of stuff. And they also are checking your Strava data, similar to that Garmin study that you mentioned, where they're trying to use some of this sort of public forum metrics to get bigger samples of information.
Yeah. Yeah, I'm really fascinated by like some of the running COVID research that's coming out. I'm kind of wondering like what's going to be the point of it at all? Like,
when things
are we preparing for COVID-23 and to prevent those COVID injuries?
It's like, look, guys, we know what to do. We know what happened last time. It's like, don't worry about that virus. Let's just focus on the running injuries. No one's going to care. No one's going to listen to us.
Yeah.
So, my sense talking to you and reading the articles that I mentioned is that it seems that, medicine doesn't really know for certain of the top 3 running injuries. We don't really know what's causing them. Is that fair? In terms of, there's no specific factors that we can point to and say, don't do this, or don't buy these shoes, or don't train this much. Am I wrong there?
I think if we're talking about, let's say we're talking about combining general running injuries, we don't really know how to prevent those right now.
Right. Okay.
Because I think there's probably 2 things that happen with injury prevention and running injuries, just because there are so many ways to get a running injury and so many different types of running injuries. You either decrease the incidence of specific ones, but increase the incidence of others. So then your base rate just stayed the same. Or by decreasing some of the most common ones, you actually do decrease the base rate. Okay. And that's, I think, what we just don't know yet because we haven't had any effective injury prevention programs.
Okay. And my impression talking to runners is that they'll tend to attribute their running injury to certain things. Is there any sort of intuitive value to what runners think caused their injury? Or are they just as sort of in the dark as we are?
Yeah, so there's reason to find that information out because if we think that behavior plays a big role in running related injuries, which we do think that, then the thought is, well, if we can educate people and maybe change some behavior, have them worry less about this stuff and maybe a little bit more about this stuff, then we might be able to change running related injury risk. A couple studies have looked at that. I think Saragiotto and Johansson, I think, a few years back. And basically just descriptive studies surveying runners and saying, what do you think causes an injury? And some of them were kind of pretty reasonable. They're like doing too much too soon, not listening to my body, running through pain. And then those are probably the intuitive ones where we would say also as healthcare providers, yeah, you should probably not do that stuff. It's sensible to not spike your training or not listen to your body when you're starting to develop a little ache and pain that's not a full-fledged injury. And then there's other recurring themes that come up in those surveys too, like footwear, inappropriate footwear per foot type, foot posture, not stretching, not warming up. Things that just haven't, that aren't backed by evidence that lead to running related injury risk.
And is that because these things haven't been looked into, or is that because these things have been looked into in some of the studies that we were referencing, and for whatever reason, perhaps the studies weren't big enough, or or whatever, we we have some evidence and we think they're not related, or we just don't have any evidence and we just don't know.
Right. I think what we could say about stretching is that we have no evidence that it does prevent injuries. And that is intuitive to me because distance running is not a high flexibility demand sport. So not, almost none of our joints are getting taken to end range frequently during regular distance running. So to me, some dosage of stretching doesn't seem plausible to reduce injury risk.
Mm-hmm.
The footwear stuff has been investigated a lot. I mean, more than probably a lot of other areas as far as injury prevention goes. And Laurent Malice's group has probably done the majority of it. There were a couple studies that kind of panned out as motion control versus not motion control didn't really affect general running related injury risk. But then recently they did a subgroup analysis of that study and basically said, well, the runners that ended up with pronation related running related injuries seemed to have lower injury risk when they were wearing these motion control shoes compared to the runners who were wearing neutral shoes. And I think the difficult premise about that is saying that we know that there are pronation related running related injuries because we really don't.
Okay, well that's interesting because I was a bit annoyed about that study, even though I love that guy. But because it didn't reinforce my bias. And but so pronation, just for the listeners, when the arch of your foot kind of flattens down as you put weight on it, and what you're saying there is pronation related running injuries would be a running injury that was caused by, let's just say, excessive pronation, which is the foot coming too flat down to the ground. Is that and what are you saying there, that we don't know if that's related to any specific running injury?
Yeah, it just hasn't been strongly linked to many specific running related injuries at all. And as far as general running injury goes, Rasmus Nielsen did a study years ago that looked at just the foot posture of an individual, and it was if I remember, the runners with the most extreme foot postures were injured less than the runners with more neutral foot position. So
I like that one more because it was like, well, doesn't matter what your foot looks like. There's other things we've got to care about.
That makes sense of that.
Would you say then, based on your understanding of reading all of that research, that the running shoe, we can't say that it is related to a certain type of injury? Is that where we're at the minute?
Yeah, I think it has not been linked to specific types of running injuries, but I think from a plausibility standpoint, it's always higher on my radar if it's related to a foot and ankle condition. So that would be where the main difference is, just from a biomechanics standpoint, of say wearing a minimalist shoe versus a maximalist shoe, is that the shoe with less stuff underneath it is going to load the foot and ankle more. And so we could even just kind of consider that, well, if somebody switches to a shoe that is drastically different than the thing that they were just wearing, that's essentially a training load error. It's just shifting more stress to a certain tissue and then having that non-adapted tissue all of a sudden take on a lot more stress.
So it wasn't so much that it was the wrong shoe or a bad shoe or not the right shoe for their biomechanics. It was just that they weren't used to that shoe. They were used to a different shoe and they changed too quickly.
Yeah, in the cases of one of those, like I changed shoes and then immediately got injured type situations, there's still folks who would say that a shoe might be the wrong shoe for somebody and that eventually they will get injured as a result, as more of that like cumulative loading. That's harder for me to kind of get into, because you get to that question of like, well, do we adapt? And what's the ceiling of adaptability? And maybe the ceiling of adaptability for the first toe is going to be different than my ceiling of adaptability of my calf muscle or something like that. So it might just be this game of like, well, you shifted stress to an area of the body that was most adaptable, and that is what caused you to be pretty good and robust for a while. But if you
Right.
accidentally shift too much stress to an area that just doesn't have a very high ceiling and doesn't have that much room to adapt past that point, then you're probably redlining it a little bit.
So I just try and make a practical example out of that. If you look at some of the shoes that are more minimalist, like let's say the 5 fingers, and
Yeah.
my understanding is that generally speaking, someone who transitions to that type of shoe will put more stress on their foot, more stress on their Achilles, less stress on their knee, probably. And then what you're saying there is that if there is any shoe that will prevent injuries, it will be by relocating stress from a very highly resilient part of the body, sort of inherently, to from a lower
Yes.
stress resilient part to a higher stress resilient part, and that sounds ambitious to me. I don't see why an Achilles tendon would be infinitely more or a lot more adaptable than, let's say, the knee joint, the patellofemoral joint.
Yeah, I tend to agree. I think it's hard to. I mean, we could look at biomechanical studies of like in vivo failure rates of some of these tissues, but I don't know that really helps us with like, well, you're this far away from failure, so you might not develop patellofemoral pain. Yeah, it's really hard to say because in some, I myself develop patellofemoral pain much more than any other running related injury. So to me, I would say that my stress shifting should be away from my patellofemoral joint, just because it is proven again and again that it is less adaptable than some of the other areas of my running body.
That's an interesting way of looking at it. I haven't thought about that before. If you have a problematic part of the body, are the things we've learned from the research that will move stress away from that part to other parts that have shown themselves to be doing all right? Because I'm the exact opposite. I've had bazillions of running injuries over the last 10 years. All of them, all but one of them were shin down.
Okay.
No knee pain, really, once. It was minor. Everything else, like shin pain galore. I believe I had a stress fracture in my foot. I didn't get it scanned because I just waited it out anyway.
Yeah.
Achilles tendinopathy, both sides, different places. Plantar fasciopathy, all. And I tend to, or have in the past, run in more minimalist shoes, right? Which, from what I understand, do tend to put the stress a little more in that area. I don't know, what kind of shoes do you run in? Do you think that's playing a part in your knees suffering, or do you think it's a red herring?
So I, about 10 years ago, started to transition more into minimalist shoes more regularly. So I have a shoe problem. So I rotate through a lot of shoes. But I started to throw them into my rotation more regularly because I was feeling lighter on my feet. I felt less stress on my knees, and it was easier to keep a faster cadence, which is really the variable that I'm looking for sometimes too. But yeah, I mean there are definitely some days if I'm in a bigger trainer, I just feel like I'm stomping down a little bit heavier. Is that the trainer's fault, or is that the way that my body responds to maybe just something that's a little heavier on my feet?
Or is it your impression based on the research you've read?
Sure.
I think,
yes. I mean, hard to get away from that.
Yeah, we can't pull those things apart, right? If we expect something to happen, we may be perceiving it when it maybe it is, maybe it isn't.
Yeah.
All right, this is getting very complicated. So, but I think if I try and summarize what we were discussing there, it's essentially that in terms of shoes, we can't, based on the current evidence, say these types of shoes will result in less injuries overall when applied to a large population of runners than another type of shoe. And it's both ways, right? It's like, you can't take an older model of shoe from the 90s, that's maybe not as trendy now because we've got better ones. That one is no more likely to result in injuries than any other shoe.
Yeah, I think that's why I have a hard time thinking that any shoe could reduce global running injury risk, because all it's just going to do is shift stress to a certain part of the body. That's what they do. You're taking from one area to give to the other, or vice versa.
Yeah, and then the question is, can that area cope with
Yeah.
the amount of stress you put on it?
And theoretically, I get it when people say like, well, the reason we want to transition our runners into minimalist shoes is so that we can reduce some of these high probability running injuries. I'm just not certain that it's not going to just exchange rates instead of reducing the overall rate.
Right. And that's, and that might be where, if we start to see more studies come out, like you say, saying we're going to look at patellofemoral pain, so we need a large sample, we've found that minimalist shoes make patellofemoral pain less likely. This is all speculative at this point. Yeah. But then it's like, if someone has patellofemoral pain, or people who've had it in the past and have had trouble with it, we could then what's the word? Like, in advance, we could recommend those
prophylactically.
Types. Yeah. Right. But we're not there yet. So, when you go into the running store and they look at your foot posture and they look at the way you run or whatever, and they say, these will make you less likely to get injured, that's probably not evidence-based at the minute. That sounds like where we're at.
Yeah. Yeah. And I think it's almost easier to give recommendations to somebody who has had a really chronic chronic injury, rather than somebody who has never had a running injury before, because we're kind of pulling off of that. Well, if you've had this injury in the past, that makes you more likely to have it again. That's like the one thing that we do know. So if we could just do this one thing to reduce the risk of this specific injury, you might be good, but it also might set you up for something else. Yeah,
we're making ourselves sound very ignorant and kind of useless. So I'm not sure I'm going to publish this episode. It's not going to be good for physiotherapists specializing in running injuries. Okay, so shoes, we can't make broad recommendations, but we know that they do shift stress around the body, so we can use some of that in a real world situation with a specific person. Like if we were talking about your knee pain, we could look at maybe certain types of shoes to help with that. Okay. Now, what about other things? What are some other things that might cause injury, or that runners think cause injury, and are they on the right lines or not?
Yeah, I think one of the really interesting areas of like the injury prevention research, there's been 2 studies that have looked at trying to change behavior through education. Because if we think that it's that people just don't know that they're running too much too soon, or they don't know what good training habits are, then theoretically educating them on these things might lead to some behavior change. We know that behavior change is more complicated than that, probably, but and they both counteracted each other. So there was one study that showed that the behavior-based intervention just didn't change injury rates. And the other that did show that it reduced injury risk a little bit also showed that it didn't actually change behavior. So they took, this was Hespinol Jr.'s study, I think in 2018 maybe. They did this behavioral intervention. They followed them for like 6 months, and they assessed basically, did you watch the thing? Did you get injured? And did you change any of your behaviors? And the runners that got the educational intervention, they had like 7% fewer injuries, but they didn't actually change their behavior. So did that educational information work?
What was the educational information?
It was a pamphlet, and it kind of it gave very general recommendations on like, don't increase your mileage too much and wear footwear that works for you. It was all very kind of like,
is that
kind of middle of the road stuff.
So they give them these educational information. They behave in exactly the same way as the other group who, didn't get it.
Yeah.
But then they get injured less. Is that just like a false positive kind of thing? Is that?
Yeah, that's what I would think.
Okay.
I mean, I can't think of any other reason why they would have gotten injured less just from taking on information, but not actually doing anything with the information.
Belief was there. I know. I'm too
and that
smart
belief,
to get
that belief
now.
just bolstered their Achilles tendon.
Well, I mean, I think if that happened a few more times, we'd have to say, there's something we're not seeing here. But at the minute, I think just based on the fact that we can't come up with it, I don't know if the authors, did they speculate as to, or did they just say, we don't know?
I think they were just like, this group got injured less, so let's roll with it.
Just the facts. This is what happened. Okay. Do you need to head off? I know it's taken us a while just to even get started on this.
Yeah.
I had a feeling, because I listened to one of your other podcasts, I thought when I get him talking about running, and particularly running shoes, this might last a while. So I didn't put anything else on the docket for tonight. Okay, so if I could try and summarize again, because it is quite a big topic, this, and I know that it's not. Yeah. When I asked you to come on and talk, I was like, this is a hard thing to talk about because it's so big. But so we don't know that a specific type of shoe is going to cause an injury. So we shouldn't stress too much about that unless you've had particular problems. We're pretty sure that flexibility is not relevant in terms of, so stretching is probably not going to be particularly protective against running injuries. We do think that like adaptive capacity, or the balance between recovery and training stress is important. We think that's the key, because most running injuries are repetitive stress injuries, right? The ones, the top three that you mentioned. So that probably is an important thing, that the amount and intensity of training and how that changes over time probably is important, but there's not a ton of evidence on it, maybe because it's very hard to measure. Is that?
Yeah. I think it's hard to measure, and I don't know, it seems like setting up a trial where you would just have one group do an absurdly large increase in training load. It might run into some ethical barriers.
I love it. That's a good study. We're going to double training volume every week for 10 weeks.
I mean, some runners would be totally down for it.
We'll see who gets injured, and they all get injured.
Yeah, hard to analyze that one too.
It's like, yep, it was definitely, training load was definitely a factor. Okay.
Oh, that's a great study, actually.
It's like, well, you could take it to the ethics board and say, well, no, we're just basing this on assumption. That isn't science. We need to prove it. Okay, so so strength was the other one I wanted to ask you about, because that has definitely become more popular in recent years, and even in mainstream, publications, Runner's World, triathlon magazines, you see strength training being talked about a lot more. Is the evidence there for that?
Yeah, so I love the fact that strength training is getting more popular and is appearing more in the popular media for distance runners. I think we're getting the idea out there that weightlifting doesn't make you bulkier or slower. It actually seems like it does the opposite from a running economy standpoint. It makes you more efficient and leads to performance improvements. But we haven't seen that it reduces injury risk. And there's been a couple studies that really haven't looked at strength training by definition in the injury literature. Certainly, from a performance standpoint, Rich Blagrove's work is probably the place to go. He's got a good systematic review on that stuff, and has written a couple books on it at this point too. From an injury literature standpoint, there's two studies that came out recently. One was in the New York City Marathon. They took novice marathon runners and had them do a home resistance training plan, and it was basically body weight stuff. Maybe, body weight squats, lunges, RDLs, and it was progressed to turn into jumping, but it was not tracked. So they didn't know who progressed it into the difficult one versus who was kind of just keeping with body weight stuff. There was no difference in the groups, essentially, as far as injury rates at the end of the marathon. And the big criticism is basically, well, is that program a strength training program, or is it just a resistance training program? You would probably not say that it's a strength training program by definition, because the resistances weren't high enough to effectively build strength, unless somebody was extremely detrained, I would say, in which case they might not want to be running a marathon. But The other side of it is what we could say about that is normally in some of these studies where you just compare A versus A plus B, so where A is running and B is some sort of other intervention on top of that. And this is even outside of running literature. In most exercise or physiotherapy literature, there's like the compare these two groups, both of them are getting A, but then we added B, and the group that got A plus B did a little bit better. You never know that the reason they did better is because of the specific effect of B or just the fact that they got more stuff. So a non-specific treatment effect versus the fact that B actually is what it takes to get better. And that's what I think that study showed, is that just giving them a little bit more training didn't reduce injury risk. So there was no non-specific effect of giving a body weight resistance program a couple days a week.
Yeah, that's an interesting way of looking at that.
Which then means maybe you do need a higher stimulus if we think that it's about conditioning specific tissue to get to maximal loading.
And if such a study were to be done and found a difference, you could use that other study as saying, a strength program that didn't make you stronger doesn't help. You have to get stronger.
Yeah.
Because I read that study and I was like, I get it, because it's like, it's an effectiveness study, right? It's like, let's see if this is very practical, real world. It's very easy to do. If it works, it's going to be awesome because we can just roll it right out to the general population. The runners can just start doing the exercises on here, but it didn't, right? So, so it may be that the theory goes that, you have to get stronger. And that's, I think you and I probably share this bias with our athletes, that we try and encourage that. We try and get them to go to the gym and go really heavy and get stronger. But I am still waiting for that study that tells me I could do this.
Well, we have it at least to say that you can do it to make people better runners.
Better runners.
I think that's like, at the end of the day, when people are pushing injury prevention programs in the first place, it's usually less of a sell to tell a coach that this prevents injury. It's more of a sell to say that this improves performance. Yeah. Even though injury risk reduction should be at the forefront of a coach's program, because an injured player is not an effective player. So it's this, a little bit of the short-term pay in for long-term gain, I guess, from a resource and time standpoint. But yeah, we just, the other study that came out recently that did show a running injury risk reduction was kind of like very low level foot and ankle exercises. And they essentially did the same thing. They very much underloaded people, but they gave them 30 minutes of exercise 3 days a week. And their group showed fewer injuries at the end of the study.
Okay. So what's going on there?
Although not fewer injuries in the foot and ankle, which is where you would expect a foot and ankle program to reduce injury risk.
Okay. I haven't read that one, so I'd have to be a little ignorant there. So is that A versus A plus B kind of design that might be misleading us there, or is that,
Yes, somewhat. So the control group, so this was a TADDEI, TADDEI. Never sure if I'm pronouncing any of these correct. And that came out, I think, at the end of last year, maybe 2020 or so. So the control group did like 5 minutes of stretching 3 days a week, and the intervention group,
they did get something.
They got something.
A and B versus A and C. So it was
yes, and the dosage of C was just much higher than the dosage of B. Because the group that got the exercises, it was like the exercise program ended up taking between 20 and 40 minutes. If I remember.
How do you fill up 40 minutes of foot exercises?
They were just like tapping their toes around the whole time.
I don't know if I could sell that, even if it does work.
I know. And they had like the one of the investigators was like FaceTiming them while they did it, I think, or like video supervising them. Okay. And they actually followed them for a while. It was
I'll have to read that. So impressive. What do you make of that? Is it A versus A plus B? The way they've set that up, because that, if they are doing it 10 times longer or whatever it is, you can't really call that stretching group a control group.
I've kind of gone back and forth on it. I think it's possible that it was just that non-specific treatment effect of getting more stuff, but I actually am now kind of leaning towards it. It might have just been a statistical one of those things, just random chance, because I just don't see any plausibility for that intervention program to actually reduce injury risk, especially because it didn't change the relative number of foot and ankle injuries side to side. Or
I don't. Was it the primary outcome running related injuries?
It was
like in all areas.
Yeah, all injuries. So they weren't adequately powered to subgroup.
Right, that's what I was saying.
Analyze the injuries, but they released the data on like this many foot and ankle, this many knee, this many hip, and yeah, you would think.
I mean, if they had showed, it would have been better if the primary outcome was foot and ankle injuries, and then they had shown. I think that would be more convincing.
Yeah. But then the issue is they would have had 5 and 4 as their ends for both sides.
So
and
they need. Oh yeah, that's a very small difference. Okay. Yeah. So we can't take much away from that in terms of foot strengthening. Like maybe just more investigation needed. Really, there. It's not. It's not conclusive either way. So foot and ankle, or foot strengthening. Let's say, was it foot and ankle or foot?
It was foot and ankle. There were some heel raises in there.
Because I think logically, I think that is a good target if you want to test strength training to see if strength can help prevent running related injuries. I think you'd have to. Well, that's the trouble, because now talking to you, I'm like, well, you can see if it prevents Achilles tendinopathy if you do really heavy calf strengthening exercises. But then, like you said, how big a sample do you need for that study to get enough tendon injuries in the control group to say that there's a difference between the control and the experimental? So how do we get around that?
You need 1,000 runner cohort.
Really? Okay. So okay. That's very hard, man.
Everything, if you want to analyze training load and calf strength and any of the other variables that we think could interact to produce Achilles tendinopathy, which is probably a couple training load measures and plantar flexor strength and maybe dorsiflexion range of motion, if you want to analyze that as well. And then, with each of those variables that you're going to cut the sample size up with, you have to have that sample be big enough so that when it's cut up a bunch of different ways, you're not winding up with a bunch of false positives.
So how do we move forward from here? If we want to try and understand what is causing different injuries, it sounds to me like we're stuck. Because I can't imagine studies that big being done for these kinds of injuries. I mean, it's not like we're talking about drugs that we can sell. It's like calf raises, no, who's gonna fund all this stuff?
Yeah, it's tough. Because you're getting into the what they're looking at with some of the like artificial intelligence. They're plugging in some known factors, and then they use some of this modeling that's very similar to like virology modeling to see, okay, if we plug in all of these factors, can we estimate how long it takes for a runner to get injured with these characteristics and things like that? But it's no better than just conjecture at this stage. We still, I think from a where do you go standpoint, it's starting to just look at specific running related injuries and then running this trip framework to see if you can prevent patellofemoral pain, or you can prevent Achilles tendinopathy. And then that takes 20 years. And you combine that and, okay, well, what did the program that helped to prevent some patellofemoral pain, what did that look like? And what did the program that
what are the similarities?
Achilles, and can we stack these together? And does that have a beneficial effect for both of them? Or we skip all of that and just make a preventive measure that's just strengthening your quads, your calf, and
that's what I'm thinking.
Shin bone. It's just it's pogo hops, heel raises, and quad extensions, and
that's clinically that's where I end up. Do you know what I mean? I sort of have this program is pretty much exactly what you just described. I try and get, by the time, the runner comes in injured, hopefully they leave not injured or less injured. They are doing those things, once or twice a week, really heavy. I understand that I don't have a huge base of evidence to support that. But I do think, given the performance enhancing effects, the quality of life research seems to be pretty clear that, especially as we age, if we remain strong, I was talking to Claire Munchell about this a couple of weeks ago, that the side effects are all good. It's not like giving drugs where there's negative side effects. So if we're wrong about strength, the only downside is the other things that'll get a bit better when you've spent some time on something thinking you were going to get less running injuries, and you might not.
Yeah. I think the thing that I think is toughest is then when you come across the runner who just absolutely does not want to strength train, because then it's a tough sell, because it's like,
you could argue then, though, that you don't have to sell it that hard. If we don't have that really convincing evidence that strength training, I mean, we've got the common sense of too much too soon. I don't know that we've really added much in the last 50 years, if that's all we've got. And strength is a maybe. But we've got other things that were like, probably not. Stretching, shoes, well, technique, I suppose. Let's get off strength.
Sure. Yeah.
What does technique play a role in? I mean, I'm seeing a pattern here, so I think I know what you're going to say.
Right.
But what do we know about technique and how it relates to running injuries of a specific type? If you want to.
Yeah. So I mean, I think you could say like for different types of running, say. Somebody who is running with a slower step rate, slower than maybe the mid 160s or so, and they have a high hip adduction angle at mid stance. That type of
Sorry, running, Jason, could you just tell people what that is? Just for
sure, yeah. So hip adduction would basically be like if you're in mid stance and your knees are knocking together, you're creating that kind of sharper angle. That seems to be related to the onset of patellofemoral pain, more so in women than in men. So that's kind of a very specific, like, here's when running biomechanics might be playing a role in some things. And even that is pretty well debated. And the difference between high hip adduction angle and normal hip adduction angle might only be a few degrees. And if that's the case, like, can we even see that most of the time? But I mean, you could say, all right, if somebody is coming in with this chronic history of patellofemoral pain and they're running like that, then maybe we just want to change that and see what happens.
Okay.
That to me is where, like, the common sense, like, what if we just shifted a little bit of load away from that anterior knee by getting them to do something different? And if they totally hate it and they don't want to do that, well, then let's go work on some other things. But that's where I think gait retraining is effective, or changing someone's running technique can be effective. Because as far as like manipulating somebody's step rate or their cadence at this stage, we're pretty sure that that's a pretty good external cue to be able to get them to land a little bit lighter and shift a little bit of weight away from their knee and their hip. Mm-hmm. It's a little bit less clear what it does around the foot and ankle. But you can also use somebody's symptom response as, well, this is a good or bad thing then, based on that.
A lot of runners are worried that they are running in a way that will cause injury. You'll say, I want to look at my technique because I don't want to get injured. Do we know if can we identify ways of running that they should avoid? Or is it more, you have to run for a while and we'll see if you get problems in certain areas and then we can tweak things,
Yeah, I mean, it's certainly easier to do the latter.
Okay.
than the someone with a clean slate coming in and just saying, like, here's how I'm running. Should I change this?
Yeah.
Because some of what we see when we're running, even if it looks a little weird to us, is the body's self-selected movement pattern. And when we deviate outside of that, well, we're gonna worsen running economy, at least in the short term. We know that for any change in running biomechanics in the short term, somebody is going to have to expend more energy just to do their regular running. Outside that, we don't have that much that's convincing to tell us if you're running like this, you're going to go develop this thing too. Because it kind of goes back to which structure here is most adaptable versus which one might have a lower ceiling for adaptability. And we just don't know for each individual that walks in the door.
Well, I think that helps. I mean, it helps me understand, hoping it helps other people who are listening understand that why it's so difficult to give injury prevention advice, regarding all of the things that we've discussed that are very common. They're on runners' mind. I would specifically like to ask about, because it's something I've read about, and I think sometimes I've gone too far with saying that impact or vertical loading rate or stomping, right, for the very lay way of putting it, is more likely to give people particularly shin pain. Am I barking up the wrong tree? Is there not enough evidence for that?
Yeah, I think recently the thing that's changed my mind the most about that has been how we're looking at quantifying bone loads. So the paper a couple of years ago, Emily Matchevich out of Vanderbilt was basically seeing that the actual that ground reaction force and how it relates to tibial bone loading is much less than the actual strain of just the calf muscle contracting and pulling and tensioning the bone itself. So we might not actually, vertical ground reaction force might just not be a very good proxy measure of tibial bone loading. And if that's the case, then can we even use that then to say, let's decrease this or let's change this or whatever? Another really fascinating thing, Brian Heiderscheit, who has done a lot of really, really great research, especially in the field of running cadence and running biomechanics. I had asked him this question a couple months back about what happens when you cue a runner to just land a little bit lighter. And he basically speculated it actually probably increases tibial bone loading because it causes because it causes a little bit more co-contraction.
Okay, that makes sense when you explain it like that. I'm going to translate a little bit. Just so what you're saying is the stomping, right? That they're hitting the treadmill really hard. We're no, don't do that. Land lighter. But what actually might be happening is that we think we're influenced how much stress is being experienced by the shin bone, the tibia. But actually the effort of trying to land more softly, maybe contracting the muscles in such a way that it actually stresses the bone the same or more than.
Yeah. Now you could still say, right, you could still say that is that tension force on the bone the same as a compression force?
Right, yeah.
And that's probably not, because bone responds differently to compression than to tension. But if we're just talking about the magnitude of bone loading, it's pretty wild, isn't it?
It does. It seems to be a little easier once someone's injured, because then you can just try it. And if their shins feel worse when they do it, then you wouldn't do it anyway.
Yeah, right.
But when you're talking about trying to prevent injuries in uninjured people, again, it gets very difficult. We don't really know.
Yeah. Now, the good part about all of this is that it's rare that you ever see a runner who's never had an injury.
Yeah, that's a good point.
So we're almost talking about a very, very, very specific example.
Well, I do get the odd person who's taken up running and wants to avoid injuries.
Yeah. Outside of novice running, where you're getting someone right on the cusp of I'm picking it up for the first time.
And I think, based on talking to you for the last hour, I don't think I'm miles off by telling them, the main thing we need to learn is not too much too soon. If we can get that, that's a good foundation, and then other things we can are more like a maybe, but that's hard enough on its own.
Yeah, I still keep going back to that. Try to avoid too much too soon, whatever too much too soon is for you.
Right.
And it's like one of those things that it's so plausible that you feel like you can still keep saying it, because until it would take a lot for me to see evidence that says like actually doing too much too soon doesn't increase injury risk at all for
Well, I think
running injuries.
the reason that, I went looking and I couldn't find anything, I think the reason this doesn't get studied is because, if you take the contrary statement is it does not matter how much running you do next week compared to this week, right? You could do 1,000 times more kilometers next week and you won't get into like, that's just kind of silly. So there must be somewhere along that, rate of increase, steepness of the curve that an injury develops. It would just seem to defy any kind of perception that we have of the normal world to not.
It certainly defies our theoretical framework for what a running related injury is, which is this imbalance between recovery and load.
Yeah, which isn't just, it is a theory, but it's not just plucked out of the air. It's based on a lot of work and different fields of study that, in bone stress injuries, in tendon problems, in patellofemoral pain, in different areas, that it's a reasonable theory. And it sort of makes, it sort of passes the sniff test, right? It makes sense, even if you haven't got the RCT where you sort of make people run too much. Okay.
Still holding out hope for that, though.
I would not volunteer. I'll be in the control group.
There you go.
So, how would you sum things up for the runner looking to avoid injuries? What advice would you have for them?
Yeah, I think I keep going back, and we just talked about the try to avoid frequent training spikes. I think that also involves too much deloading, because anytime you're doing a sharp deload, then you still have to get back up the hill somehow too. Good point. So sometimes it's not always about, just doing more and more, but trying to keep things relatively consistent. Trying to change as few variables at a time as you can. So if you're going into a block where you're trying to increase your running volume, trying to keep running intensity relatively stable, or you're going into a new block where you're working on more track intervals, maybe you consider decreasing running volume or keeping volume relatively consistent, things like that. I think the addressing your previous injuries is pretty key. So this is from a strength and conditioning standpoint. What I like to do with my clients is like, everybody gets the main stuff, your squat, your deadlift, your whatever accessories, but wherever that person had a relatively significant injury history, that area gets bolstered a little bit more. So if it's
that's really good advice. Yeah.
Somebody that's had a proximal hamstring tendinopathy in the past, they're going to get an extra hamstring accessory exercise into the mix, because I'm not positive that it's going to help prevent that injury in the future, but it theoretically makes sense that if we build up that local tissue capacity, it'll be able to tolerate more over time. And there's plenty of debate about local tissue capacity versus sport specific capacity and how those aren't exactly the same thing. But to me, it seems like one of those, the net positive is there,
Yeah. It's like there's no big harm other than an opportunity cost to doing an extra set on the hamstring curl machine. It's not going to negatively impact you in a significant way.
Right. Yeah. And this is kind of like the guess and check, but finding a sustainable training program for you. And that's the toughest thing, because you often don't realize what's not sustainable until you've already gotten injured. And it's some runners are going to be able to tolerate more volume. Other runners are not going to be able to tolerate as much volume, but can tolerate the speed work a little bit more. Maybe that kind of goes back to what was that runner originally built to do from a distance standpoint. Certainly, some of us are more built for certain distances than others. But over time, you kind of see patterns in your own training and you realize what works. And if you don't, then getting a coach is usually a pretty good idea to help out with sustainable training. I think those are kind of the main points. Listen to your body. There's another one. If you feel like something is, you got the minor ache and pain coming on, or you're just not feeling it that day. Your body doesn't care that the schedule had 12 by 400s on it. You can just not do that workout today. and listen to your body and take it a little bit easier, because it's the sport is about sustainability, right? And consistency over time. So it's never worth just going after it for a big workout on a day that you're not feeling it.
So just trying to take that longer term view is probably,
exactly.
if you're always thinking about the long term, you're less likely to indulge in behaviors that are going to get you injured.
Yeah. Or I don't know if we know anything about behavioral research based on the populations here, but it makes sense to think about the long term, what's sustainable. Yeah.
Okay, that's a very nice summary of a very complicated topic, and thanks for trying to sort of dig into it in a really critical way, because you hear a quick Google of how do I prevent running injuries, will get you some pretty crap, useless, not evidence-based advice. And I wanted, I've seen your stuff online and on Twitter, and I wanted somebody who could sort of dig into the complexity of it and try and help runners understand what we know and what we don't know, and why it's difficult to be precise in our recommendation. I think you've done a really wonderful job of that. So thank you.
Yeah, thanks a lot for having me on, Matthew. I think we should never be in the same study together, because it would just confound all the data.
I think it might. If someone wants to, follow you online or learn a little bit about more from you, where would you point them to?
I'm usually pretty active on Twitter, probably most. I think I'm at Jason Tuori PT. Yeah, PT. And Instagram, usually I'm on there a little bit too, jasontuori.dpt. Outside that, if you want to post my email address in the show notes, okay. I'm happy to field some questions, anything like that. But yeah, those
wonderful.
Usually...
I will. Yeah, I'll link all those up in the show notes. And yes, I do enjoy your Instagram. It's you're the only person on Instagram it's always like a study. It's like a screenshot of a study, and then you go through it. I think you're like the only person on Instagram who does that.
Yeah, that was like the main reason I had started. I was like, let me just pop some research up here, and then really you realize
it's totally different to everything else. You scroll by, and you're like, oh, what's this?
Yeah. Well, then you realize like you kind of have to start alternating it with like other things, some videos or pictures of other stuff, just to kind of keep people's attention. Now it's like a paper every couple posts or
maybe so. Like a video of you reading a paper.
Yeah, there you go. That's a good idea.
Then a video of you, like a screen share of you highlighting a paper. Like that's basically all you're doing.
Oh, that's great content.
You can have millions of followers in no time.
Awesome.
Okay, well, thank you very much. I'm going to stop it there, Jason. One sec.